Transforming Healthcare brought to you by the QE2 Home Lottery.
Welcome back to Global News Morning. Well, today there are approximately 45,000 Nova Scotians receiving some form of cancer care in our province, and our next guest is at the forefront of innovation so that these patients and their families have a better experience. Dr. Amanda Caissie is a radiation oncologist at the QE2 and the medical director of the Oncology Transformation Project. Now, she's also a global leader in digital oncology focused on patient impact. And speaking of digital, Dr. Caissie is here to tell us more about Noona, a new tool that is transforming healthcare in our province and beyond. Good morning, Dr. Caissie. How are you today?
I'm excellent. Thank you for having me.
Yeah, it's a pleasure to have you on the show. Before we get into the new Noona tool, why don't you give us a bit of a rundown on the Transformational Oncology Transformation Project, or OTP?
Absolutely. So the Oncology Transformation Project just started last year is a very unique partnership between Nova Scotia Health's Cancer Care Program, the government, and our industry partner, Varian. The main goal is to establish a connected network of cancer-specific digital health solutions, but healthcare services that are connected across the province. It's meant to support and connect care providers, patients along the cancer care journey, all the way from prevention and screening through to survivorship.
And so Noona is a big kind of tool in this toolbox that is OTP. Tell us a bit about Noona and the success you've had in just a couple of years so far.
Exactly. So there is within OTP the Oncology Information System component, which helps healthcare providers connect. But Noona is the powerful patient engagement application that puts the patient voice at the center. It allows the patients to connect with their healthcare teams in so many different ways. And that's why we consider it a foundation of OTP.
Yeah, exactly. And so, you know, when someone gets that unfortunate diagnosis, of course, that you have cancer, and it looks like rates are expected to rise by 25% just over the next 5 years alone. How long after that diagnosis does someone get the news like, hey, we have this innovative technology, it's called Noona, to kind of make you a part of the team? When do they get that, and have you seen success with that since it's been launched?
Absolutely. So we're extremely excited that since go live OTP in June of this year, each and every patient with cancer coming into the system will have the opportunity or the invitation to join and have Noona as a way to connect with their healthcare team, even before they come into their very first clinic visit. Being able to see, for example, their treatment schedules on their own devices, just as that one first step to showing that they are connected with the team.
Yeah, and how important is it to ensure that a patient is connected with the team during the entire journey?
Yeah, the journey is so important. And as you mentioned, the increasing rates of cancer, it's so critical that we can support patients not only throughout their treatment, but also in their survivorship phase when they're done treatment, when they're at home. So the fact that Noona is something that allows us to reach patients in a remote setting from home, for example, remote symptom monitoring, release of patient education material. So regardless of where you live in the province, patients can access this powerful tool and have that connect with their healthcare team.
Are there any other ways, too, that some of this kind of alleviates some of the issues we have in our healthcare system in Nova Scotia now?
Absolutely. So the patients should really feel that connection, the ability to communicate. That is so critical if you think of the symptoms and the concerns that they may have. We can address those concerns real time, perhaps avoid emergency room visits, or help the patient realize that such a visit may be warranted. And that is a very, I would say, a huge benefit to Noona from a healthcare system perspective as well, that it's been shown to decrease hospital admissions and emergency rate visits when you can respond to the patient needs in real time so quickly.
And I guess we should say, too, that this is also kind of a first for Nova Scotia. A lot of people in the industry are looking towards this province now with this technology, right?
They absolutely are. So this type of initiative not only puts cutting edge technology in the hands of Nova Scotians, providing basic standard of care, but innovation, as we said, it really puts Nova Scotia on a world stage so that we can share our lessons learned to benefit cancer centers and patients across the globe.
And some of this technology, of course, can't happen without donor support. It looks like through donor support, the QE2 Foundation is on a mission to raise $1.1 million just for Noona alone. So you know where the money is going when you donate.
Absolutely. Donor support of such an initiative has potential to impact each and every cancer patient of the province. It's enabling that innovation that allows us to go beyond the standard of care piece for Noona and really ask those critical next step questions. You know, are we capturing the voice of patients from historically underrepresented populations, those that are difficult to reach and equity deserving? So be it our rural or Indigenous communities of Nova Scotia, just to list a few, this is truly the innovation that's going to allow us to reach more patients in the province of Nova Scotia.
Up against it for time this morning, Dr. Caissie, but we're lucky to have you here in our neck of the woods here in Nova Scotia. Keep up the good work, and thanks for the time this morning.
Thank you to the kind gifts from all donors.
Dr. Amanda Caissie joining us right there. And don't forget, the QE2 Home Lottery is on. A bonus prize deadline once again, midnight tonight. It's QE2HomeLottery.com, or you can also phone to get your tickets at 1-800-233-4877. Get the break on Global News Morning. We're back with more right after this. Stay with us.